Good morning, everyone. How is everyone doing today?
Good.
I'm Stephanie with Omni Healthcare, and I want to thank you guys for joining us today. Omni has partnered with Hope Neurology, and today we have Dr. Ali, Lindsay, as well as Christopher Long with Benchmark that will be discussing Hope Neurological and their medical services and what Benchmark can do partnering with them. Without further ado, I will have Dr. Ali introduce himself.
Hello? Hello?
Hi.
You
Hey,
hear
good
me?
morning.
Hey, good morning, everyone. I am Dr. Ali Eltom. I am a neurologist working for Hope Neurological Services, mainly covering TBI. I also work as a neuro hospitalist with Eastside Medical Center here at Atlanta. I graduated from neurology residency at Howard University Hospital 2019, and I am currently board licensed at both Georgia and North Carolina. Before I moved to Georgia recently, I was in North Carolina where I used to work for Disability Determination Services. And during that time, many of the patients were soldiers with TBI, while some others were victims of motor vehicle accidents or falls. So I look forward to be one of the neurologists working for Hope Neurological Services to cooperate with you, helping patients that have been involved in trauma. And during a telemedicine encounter, I'll be reviewing the accident history and correlated with the symptoms, and then we'll outline a management plan. Then patient will be able to complete the recommended imaging and therapy locally, and medications can be called in their pharmacy. Thank you.
Sure. Great. Thanks so much, Dr. Ali.
You're welcome.
My name is Lindsay Ty. I work with Hope Neurology. I've worked a lot with personal injury over the past 10 years and have recently started with Hope, so I'll be working a lot with Dr. Ali. We made a quick little presentation kind of just about traumatic brain injuries and the treatment and things that Hope provides. And we can send that out to you. I just wanted to go over a little bit about Hope Neurology. We have 5 locations in Georgia, and now we're moving to do telemedicine in other states. South Carolina and Alabama are 2 that we're currently doing that in. And now we're starting with Omni and Benchmark in North Carolina as well. So like Dr. Ali mentioned, he'll be doing telehealth visits for now, and then any treatment that we recommend, the patients can do locally, and we can do all the follow-ups and things. We're partnering with Benchmark. They're going to be doing all of our vestibular therapy. And then eventually we're hoping to be physically in North Carolina, just, as this stuff grows. Let's see, there's just a little bit of information about traumatic brain injuries. We see a lot of this in Georgia, so I'm sure you guys see it too, and we're excited to kind of get to see patients there and help you guys out with the neurological portion of treatment for patients. But yeah, you guys can kind of go through this slideshow if you want. I also have a list of symptoms of TBIs that we give out to attorneys, that kind of things that, patients or clients describe in intake that you may not think are actually symptoms of a traumatic brain injury or something related to the auto accident. So it's been helpful with attorneys here in identifying, reasons to send the patient to a neurologist. So I can also send that out. These are some of the symptoms listed. We'll make sure that Dr. Ali does a diagnosis. That'll be helpful in the notes and things like that. he can review all of the MRIs or other scans that we order. There's different treatment options that he'll be recommending, all, like I said, all of the things they can do locally. So it shouldn't be a problem that the physician's actually in Georgia. Yeah, so that's about all I have.
Thank you.
Can I ask a question?
Yeah, absolutely.
So typically, I mean, an injury like this is something you can't see, like a fractured bone and stuff like that. So how long do these symptoms typically last for following a concussion?
So Dr. Ali, feel free to jump in. I know that we're seeing patients that we have specific testing that we can do, which we're also going to be offering in North Carolina, that can show these things. And then, I mean, it's nothing that ever goes away. Symptoms change every couple of months, so they present themselves differently. But these are like long-term effects, and that's I think the therapies help the patients, daily, but they're not, the symptoms and the brain injuries don't ever go. It's not something that goes away.
And how dangerous is it to have multiple concussions?
Dr. Ali, are you still on?
What the last question? Please repeat it.
How dangerous is it, and what are the consequences of having multiple concussions?
I cannot hear you very well. Can you please speak up a little bit? I mean, yeah. Again, please.
Yep. Can you hear me now?
Yeah. Okay.
I was saying, how dangerous is it to have multiple concussions, and what are the long-lasting effects of that?
Okay. Sometimes when the patient have altered function of the nervous system for more than 1 month, then that would be post-concussive syndrome, and so then we would manage that just according to the kind of symptoms the patient have. And regarding, you're asking also about the prognosis, right?
Yes.
Okay, so 15% of patients would still complain of symptoms more than 12 months after injury. So, that being said, most of them that would not exceed 12 months, having post-concussive syndrome. Time to recovery often depends on the number of initial symptoms reported. So the prognosis varies, It's according to the initial symptoms and also the comorbid conditions.
Okay. Thank you.
You're welcome.
Dr. Ali, we do have a question. Are you prescribing diffusion tensor imaging?
Am I prescribing what diffusion? Diffusion tension image? No,
Yes.
I never. That's DTI, right? Hello?
Yes.
Hello? That's DTI, MRI. I never prescribed it. And I know that this is that's an advanced form of MRI just to detect increased amyloid in the brain. I read about it. It's a promising test, but I never I never did that before, but I'm aware there's a lot going on in this regard. Many of them under research now. Even portable EEGs, they're close to be ready for use. Some of them, like the portable EEG, and also the eye track imaging. So no, the answer is no. I never did DTI, but I'm ready to practice that if needed, because I know the indications. Hello?
Okay. Do we have any other questions? No other questions? All right. Do you want to introduce our next speakers?
Our next speaker is Christopher Long with Benchmark.
All right,
And Chris, if you just want to share your screen.
Okay, great. Yeah, I'm going to try and share my screen with you guys. So let me get this pulled up for y'all. All right. Perfect. Is everyone able to see this?
Yes.
Yes.
Great. So yeah, just give you guys a quick introduction for me. I'm a practicing physical therapist clinic director out at our Mount Holly, North Carolina clinic for Benchmark Physical Therapy. I've been doing vestibular and concussion rehab for the past 2 years after getting a certification through the American Institute of Balance based out of Tampa, Florida. I've also gone through an orthopedic residency program 3 years ago that has given me some good carryover from a lot of these motor vehicle accidents. And when these patients are coming in with not only musculoskeletal issues, they're also having vestibular or concussion issues. It gives me that good full treatment effect as we go through physical therapy and how it helps. Just to kind of give you a quick background on me, I've experienced personally multiple concussions in my sporting careers through high school and college. So that spurred a lot of my interest in this. And this has given me that kind of push forward to be able to do some more independent research with various groups and teaching opportunities from that respect as well. So getting into how we treat, biggest thing that we hear people talk about, especially with vestibular or any kind of head trauma, is dizziness. And vertigo is a symptom, it's not a diagnosis. So when people talk about having vertigo, that is just a symptom of something else going on. So one of the biggest things we have are what we call BPPV, which is those crystals floating around in the ear. So that can be from something like a motor vehicle accident or any other kind of head trauma, but it can also just happen without any cause at all at this point. So it is a mechanical disorder. So that means we can reposition these crystals back into their usual spot. Like you see there in the picture, you can see those arrows as we turn that patient around and move those crystals back to where they need to be. We're doing a lot of various bed position techniques and those kind of things in order to reposition that, and then teaching the patient that for at-home treatment if we feel like it's safe for them. On average, with most clinical studies for outpatient physical therapy, these types of patients are getting better in about 1.25 visits. So usually the majority of the people coming in with just a BPPV diagnosis, it's one treatment and done. So it's very easy and simple to clean that up. Obviously, if there's other comorbidities or other musculoskeletal issues that we need to treat, then we'll treat that. But if we can go ahead and knock this out and get this better for the patient, then we will. And, there's some outliers always, so that's why it's 1.25, but the majority of the people that we get coming in with just this kind of symptom, one visit is usually the trend of what we're seeing. So, and it's mechanical in nature, just meaning that, we are able to take something that's out of place and put it back to where it needs to be, versus some of these other treatments and diagnoses that are coming into the clinic. That's not always going to be as simple and as easy as this. So if we are getting from a neurologist or an ENT a diagnosis of BPPV, we can be pretty confident if that is the only issue going on, those treatments are going to be very quick and easy. Now, on the other hand, with non-otologic diagnosis, so no crystals in the ear, it's other things going on, migraines, concussions, cervicogenic, so after like whiplash injury, those kind of things. We have 3 balanced systems within our body, so vision, the vestibular system, so the inner ear, as well as the somatosensory, which is AKA our joints and muscles feeling where we are in space. We could all close our eyes right now and turn to the left and know we're turning to the left because the vestibular system, our inner ear, is telling us that, and our muscles and joints are telling us that. So we can cancel out some of these other inputs to try and diagnose where this is coming from in terms of, is it a visual disturbance? Is it a vestibular or maybe a central nervous system disturbance? That's something that we're getting from the neurologist coming in. Is it a peripheral, so other kind of peripheral nerves or vascular damage to those vestibular labyrinth structures, as well as somatosensory. So that would be more of your coming from the neck, so coming from a whiplash injury, a joint issue, a muscle issue, something like that, that is giving false information to the brain, telling somebody they're not really moving or they are moving and they're staying still. So it's giving this mixed information to the person. So a lot of what we try to do with these types of people is quote unquote brain therapy or brain training. We are trying to help the patient either habituate to the situations that they're getting into that's causing them the dizziness, getting them to compensate in some way. So getting them to maybe, all right, don't bend over and always pick something up like that. Maybe we're sitting down to then put it up to a higher shelf so we're not having to bend over as much, or we're kneeling down, doing those kind of things to compensate through something that we just can't work around because there is that neurological level of damage either in the peripheral system or the central system that we're hearing from the neurologist. And so we know this patient isn't maybe going to fully recover. Like you were hearing before with some of these concussion symptoms, some of these are going to be permanent changes depending on what's going on and what the imaging is showing. So with that situation, we're trying to compensate and improve a lot of their habits and lifestyle changes. The adaptation, what we're looking at here is actually getting the neurological system to adapt and make those new pathways around the brain so that the brain can process this better. So these are the people that recover well from concussions. Maybe they're not having a lot of comorbid symptoms of other things that could be delaying that prognosis. So those people and their brains are able to adapt to the stimulus that we're giving them, and they're able to progress forward and get back to normal or mostly normal daily life. Most people, since we kind of got the question earlier of treatment times and prognosis, those kind of things, most of the people coming in with concussions that I've been treating over the past couple of years have been, about 2 to 3 months of physical therapy. And usually about that time, they're either better and they would report 85 to 90% better. And from that point, we kind of discharge them to a home program to continue to progress a lot of their cardiovascular fitness, their muscular fitness, and getting them back to normal activities of daily living, as well as recreation sports, playing with grandkids, whatever the issue is. And then, some people just aren't quite there yet. And 2 to 3 months out, and we're treating them at that point, we're kind of circling back around to neurologists to see what other options treatment-wise that they can help out with. Therapy is kind of stalled. There's a plateau effect coming on. We want to try and make sure we get on this earlier rather than later. So usually at that point, we're getting them back into the neurologist. Hey, it's been 2 weeks. We haven't seen any progress with any symptoms from the patient. Their dizziness handicap score has not changed over the past couple of weeks. So we're looking at what else can you do? Is there anything else? Is it just going to take time? What's your opinion at this point? But a lot of things, we do a lot of different things in the clinic. You see a little picture on here, a guy walking with head turning. So something as simple as someone walking down the street or walking down the grocery aisle and being able to look and find the item that they're looking for without getting dizzy, without falling over, without needing to lean onto that shopping cart, without, if they're walking down the street without having to lean on a sidewalk or lean on a pole somewhere close by to keep them steady as they're watching cars pass by. So we have a lot of walking with head turns. We have virtual reality goggles in the clinic that help with getting the patient a little bit disoriented and getting them to adapt or habituate to some of these situations where things are passing and crossing in front of their eyes and vision that may be mixing up a lot of their different sensory processing issues, and trying to teach them to be steady and stable during that during that therapy time, and then also getting that carryover into daily life. The beautiful thing about concussions is it's so individual to people. So not every single treatment session and progression is going to look the same, and a lot of that is just due to we don't have good, consistent testing, whether it's in the medical field or in the rehab field. There's a lot of different things that are coming out. Still, research is developing with this. So, you may see one neurology group do testing in a certain way, and another does it in another way. And same thing with PT. You get into one clinic, someone uses the SCAT5 for the sports concussion testing, if they're seeing somebody kind of acute with those concussion symptoms, and somebody else, usually we're seeing people in here like a month out sometimes. And so a dizziness handicap inventory is more appropriate at that time, because unless they're having severe short-term memory loss, then we may use something else like some of the short-term recall and those kind of things with a SCAT5 test. But I think the big thing is going forward is just making sure that, with these types of patients that aren't just those basic crystals in the ear, and we're trying to reposition things going forward, it's going to be so individualized and so different for every person. There's kind of a basic framework and concept we're trying to get through. But the total treatment times and how quickly they progress and everything like that is really hard to nail down. But I would say on average for the patients that we're seeing is about 2 to 3 months. So if you think coming a couple of times a week for those 2 to 3 months, that's anywhere from 12 to 16 visits, maybe more. But at that point, we really should have a good idea of how therapy is actually going to get them better. And if it's not, like I said, we're circling around back to that neurologist and that team to say, hey, there's a plateau. We're not getting the results that we need to get. So, is there something else we need to be doing? Is there something else you guys can do to help them out? Is it just going to take time? And that's the frustrating part for us, the patient, for, anybody that's working with this person and trying to get them moving better and, living life better back to their normal ADLs and quality of life. So I know there's probably a lot of questions. And that's great. I welcome them. There's my contact information. If you guys do need to email me, if you do have anything specific that comes up later that you just couldn't think about now, I'll leave this up here for a second while we get through some questions and some other things people may want to chime in on. Please, don't hesitate. I'm here to help out as best I can. Thank you, guys.
Thank you, Chris. That was great. Does anybody have any questions for Chris? Okay. We thank you guys for joining us today to introduce you guys to Dr. Ali, Lindsay, and Christopher Long with Benchmark PT. Just so everyone is aware, we are planning a happy hour sometime in mid-June for our attorneys and benchmark PT providers as well. Be on the lookout for an email from me, and hopefully we will see everyone soon. If anybody has any questions, feel free to reach out to any of us. Our contact information will be provided to you shortly. Thank you. Everybody have a wonderful day.
Thank you.
Thank you.